Rules Committee will come to order. So this is our fourth event examining the hunger crisis in this country. And throughout this process, we have heard over and over again how exhausting it can be for people to get the assistance they need and qualify for. Living in poverty is hard work. The process goes something like this. First, a program, whether it's SNAP or something else, makes applicants run the gauntlet. It's hard to know what programs they qualify for and where to go for help. Sometimes there's mountains of paperwork involved. Then they're wrapped in red tape. People are stuck in an endless cycle of agencies and departments at the state and federal levels that may not be talking to one another, making the process of getting help harder than it should be. Finally, people are forced to face a cutoff cliff. The moment they make even $1 over the limit, they are completely cut off from assistance under certain programs. If this sounds stressful to hear, imagine what it's like to go through it when you're urgently trying to put food on the table. Some states, like my home state of Massachusetts, are innovating, but there are a lot of states that aren't trying anything at all. Many tech companies are stepping up and trying to streamline this often frustrating, time-consuming process. This is about more than just simplifying a form or moving more things online, though that's important. This is ultimately about treating struggling Americans with the respect and dignity that they deserve. If there was ever a time for this conversation, it's right now. Congress, government agencies, and businesses, big and small, have successfully used technology in ways they never imagined during this COVID pandemic. People's minds are more open to a new way of thinking, and it is my hope that we can seize this moment and reimagine ways technology can help us not only end hunger, but give struggling Americans their dignity back. Let me just say, just to kind of put all this in perspective, to remind everybody that our goal here is ultimately to use all the material and the information that we are gathering to help with the White House Conference on Food, Nutrition, Health, and Hunger. We want to connect the dots. We want this system to work better. We want to help people. And certainly when it comes to the issue of food, which many of us believe is a fundamental human right for every single citizen in this country, we want to make sure people don't go without. So I am grateful that we have this distinguished panel. Let me read the brief biographies of everybody, and then we will go to the panelists. And if I mess up your name, please correct me, because I'm from Massachusetts, and sometimes we mess up the word Smith. So, okay, Amanda Renteria is the CEO of Code for America, a nonprofit organization that helped launch the civic tech ecosystem 10 years ago, and today partners with federal and state public servants to create equitable government systems. Robert Phillips is president and CEO of Illuma, a nonprofit social enterprise that works to make access to help and support for economically insecure people simple and easy by reimagining the way technology is used. Serena Vaina is the executive director of M-Relief, a nonprofit startup working to help people gain access to social services and eat with dignity. Jimmy Chen is the founder and CEO of Propel, creators of the Providers app. Providers is an award-winning mobile app used in over 5 million used by over 5 million Americans to manage their SNAP benefits, save money, and find jobs. And Irene Gray is the founder and CEO of Aunt Bertha, a public benefit corporation, the leading search and referral network in the U.S. Their platform is used by most major health plans, hospital systems, select residential and cause organizations. So I am grateful. Did I mispronounce anybody's name? I think Erin, it's mine, right? Erin and mine. Did I do that right?
It's Erin. You got it. Thank you.
All right.
I think, is it Renteria? Amanda, it's good to see you.
It's good to see you. Yep, you got it.
All right. Okay, great. So I will now begin with Ms. Renteria for her opening testimony.
Great. Well, thank you. And first of all, I just want to appreciate that this delay was for being able to move forward on Juneteenth as a federal holiday. I just want to appreciate everybody for that effort. I know those of us on this call were pretty excited when we heard that was the delay. So let me start off by just saying thank you, Chairman, thank you, members of the committee, and really all the staff involved in this effort. I appreciate the invitation to be here on behalf of the entire team at Code for America. We are honored and inspired to be part of such an important conversation. And I have to say, I love joining this fantastic group of folks working to make a difference. Before I begin, I want to take a personal moment to just say thank you to you, Mr. Chairman, for your steadfast commitment to this mission over the course of your career. As someone who grew up in the lowest income congressional district in my home state and among the poorest districts across the country, this fight to end hunger is personally meaningful for me. And as the former chief of staff to the chairwoman of the Agriculture Committee in the United States Senate, I deeply respect the legislative efforts you and the members of this committee have given in this fight to end hunger. So just thank you again. My name is Amanda Renteria. I'm the CEO of Code for America. We are a nonprofit organization that partners with government and communities to create a government by the people, for the people in the digital age. With this vision in mind, 10 years ago, Code for America set out on a mission to bring human-centered technology to government, starting with hunger in our home state of California. Back then, the state ranked in the bottom 5 with less than 2/3 of eligible people receiving food assistance, leaving millions behind. So we built a team of data scientists, researchers, engineers, and client experts, and started by listening to families to learn how real people interacted with government systems. Then we sat side by side with public servants, caseworkers on the front lines to fully understand the process of applying. As it turns out, applications needed answers to 200 questions over 55 unique screens, couldn't save their progress, and only could submit through a desktop computer. Navigating this process was obviously a major barrier to access. So in partnership with county governments, we created a digital assister that could be completed from a smartphone in as little as 8 minutes. As we measured outcomes, the impact was clear. The counties we partnered with saw online applications close that gap 4 times faster, and the total applications grew 10% year over year, while they decreased in non-participating counties. Today, we are the primary source for all online applications statewide, helping over 6 million people receive benefits and generating $6 billion in GDP for the state of California. We also know that if you're eligible for one safety net benefit, you're pretty likely to be eligible for another. So we have been running pilots in multiple states to integrate benefits and test outcomes. These efforts have culminated in our work in Minnesota, where we built a single streamlined online application for 9 different safety net benefits that can be completed in as little as 12 minutes. It's now live in 16 counties, covering 45% of the state population, including the district of one of your members on this committee. As we work in partnership with public servants to strengthen these programs, we also know volunteer community networks play an important role in addressing hunger. Our 25,000 volunteer network with 85 brigades across the country have contributed with mutual aid programs in the Twin Cities, SNAP screeners in Tulsa, Oklahoma, and in partnership with FEMA and the World Central Kitchen, creating food maps for low-income families, just to name a few. These national partners and state relationships and experience built over the last decade became even more critical last spring when schools closed essentially overnight and 30 million kids who relied on the school lunch program were immediately cut off. Our team worked in record time to build and consult on digital services with 13 states, including Minnesota, Maryland, Colorado, and California, on the new pandemic EBT program intended to get resources to students. In just a few months, we helped states distribute billions of dollars in grocery money to families who no longer had school meals. This kind of multi-state collaborative effort is a hopeful model for what is needed to fully transform the social safety net through human-centered technology and design. But we know also that hunger is complex, and we will need to include other government programs beyond the safety net that can help fight poverty. 2 examples we're involved in are automatic record clearance and tax benefits, where technology can make substantial improvements in both efficiency and equity. Nearly half of all children have at least one parent with a criminal record, which can too often serve as a life sentence to poverty. So we're working with 20 states across the country to automate the process of clearing eligible criminal records, which can significantly improve reentry, reduce the cost of recidivism for state governments, and greatly improve the well-being of all communities. And last year, we launched the first ever truly free mobile app to get help filing taxes in English and Spanish. And we've already distributed more than $250 million to families through tax credits. And the data shows that we've been able to reach new sets of filers. 35% of clients identified as Black, 22% identified as Latinx or Hispanic, and 25% came from the disabilities community. So today I've given you a broad, albeit very quick overview of how technology is helping fight hunger directly through safety net services and holistically through other programs. But where I want to end this testimony is to remind this committee of the stark realities about hunger and poverty we saw in the wake of the pandemic. It was only months ago when record-breaking numbers of people were out of work and completely unable to access a government office for critical benefits. It was the first time since the Great Depression where the entire nation was at once in crisis and in desperate need of government to work. But the pandemic was just a window into what we at Code for America have been seeing for years. There's a monthly cadence of regional emergencies, from natural disasters to cyber attacks on critical infrastructure. When these happen, systems consistently fail. Government buildings close, schools shut down, and too often, programs go completely dark. We can continue to let those systems erode, or we can use this moment to push for a government that truly works in the digital age. My colleagues here and in the broader civic tech ecosystem can tell you, we have all the tools we need, not just to shore up, but reimagine our systems in this country to once and for all end hunger in America. And we at Code for America stand ready to partner with governments at all levels to achieve that mission. Thank you, Mr. Chairman, and everyone here working towards that effort.
Thank you very much, Ms. Renteria. I appreciate it. I'm sorry I messed up your name, but the Henry Higgins of the Rules Committee, Congressman Ed Perlmutter, always helps me with elocution. So I want to thank him for his continued observance of my speech. So anyway, I'm now happy to yield to Mr. Phillips.
Thank you, Chairman. So good afternoon, Chairman McGovern and distinguished members. It's I would say both my honor and my pleasure to be here on behalf of Illuma, who over the last decade have served over 25 million people, connecting them to Medicaid, SNAP, TANF, SSI, EITC. And while I do want to share a few things with you about what Illuma has done and what we've learned over the past almost 20 years of working to modernize access to services and benefits, I'd be remiss if I didn't echo Amanda's sentiments and say how overwhelmed we are at Illuma with the progress that both our colleagues here testifying with us today and those who are in the field doing the Lord's work, even as we speak, are making in using our understanding of the real constraints and opportunities that exist in the social sector to design and develop technology tools that are improving the quality and security and speed of how we empower folks to get help when they need it the most, particularly as we're talking about this subject around hunger and poverty. The mere existence of our efforts is evidence of a new and bold vision. The leadership being shown to put our programs in place, the strategic approaches to effectively use what are surely scarce resources, the acknowledgement of the inequities that will impede our progress if left unaddressed, and the success we are all having in executing all attest to the strength of this vision. And talking about the role of technology in helping to address poverty and hunger, I debated about, can we go through the litany of things we've been doing over the last 19 years, or just put on the table 3 things I think we actually really need to talk about as a field that we've been pushing. And so I've opted to just say a quick note about the 3 things and wait for our discussion to actually talk about our work in more detail. And one is the role that technology can and can't play. The second is this idea that reuse is good. And I'll say what I mean more about that. And the second is that we've learned the need to focus on fairness, also known as equity, to bring the vision I mentioned to scale is an absolute necessary thing to happen. First, on the role of technology can and can't play. I won't go into the litany of challenges that we at Illuma and all of our colleagues here today face in working to make access to information and help easy and simple for anyone who finds themselves in need. But it is necessary to boil it down into something that's been well documented, and that Chairman McGovern just pointed out in his opening remarks, that finding and getting help is just harder than it needs to be. And while some states and counties are still figuring out, there's still far too many that continue to rely on inefficient, often clumsy processes and outdated standalone technology systems, which is why we all exist. And simply adding newer technology tools and approaches on its own will not reform this. This will not help people get the help that they need. It will not be the magic transformational bullet that we think that it is. But if we accept technology as an amplifier, as an accelerator, it will be a direct contributor to reforming this question around hunger and poverty. Directly driven by an analysis of sound policy and operational and technical practices, an acknowledgement of the inequities that people face, and an approach that is deeply informed by understanding of people's situations and behaviors and attitudes and problems and goals can make technology a potent tool for strengthening the resources available to folks and their ability to use it. And this is what we've actually seen over the last 19 years. Second, on reuse being good. For technology to really be able to address hunger and poverty, we have to finish something that was started 11 years ago when the Affordable Act became law. So since 2002, Illuma's been iterating on designing and developing and implementing a digital system that lets families and individuals apply for 17 programs across 5 domains: food, health, income, housing, and utilities at any time, at any place. And making sure that our systems can be used by either the person who's looking for help or by the staff person who's actually helping them, regardless of the setting. And in spite of all this functionality, the only time in the last 11 years where we actually saw real traction nationally was when Congress included the vision that any system that helps citizens access help should cooperate with each other to share data so that person is connected with as many forms of help and support as possible in an efficient way. What many in policy circles call no wrong door, interoperability, or integration. We would be having a very different conversation with you all today if that momentum allowed us to be the predominant approach to how systems designs works and how we actually use technology in the public sector. And reusing that is something that is actually important rather than reinventing something else, because that is the vision that we've been building on. Third, I want to refer back to this idea of technology as an amplifier and accelerator. It bears repeating that technology can amplify and accelerate effective solutions. And it can also amplify and accelerate well-established inequities. And so for technology to be a net positive contributor to addressing hunger and poverty, this idea can't be stressed enough. It's a paradox we have to confront and overcome if we truly want to leverage technology to work for people when they're facing the prospect of hunger and poverty. And that is a discussion that I actually really look forward to today.
Thank you very much. Ms. Mine.
Good afternoon, everyone. I'm Serena Vaina. I'm the Executive Director of the nonprofit Relief. Thank you so much for having me here today. I echo everyone's sentiments that I'm incredibly grateful to this committee for thinking critically and carefully about hunger in America. I'm here to talk about how technology can be employed ethically to close the participation gaps in the SNAP program. Relief was founded with the mission of transforming access to social services for the inherent dignity of all people, seeking to bring dignity into a process where it was previously missing. SNAP is America's most effective anti-hunger program, and it's an entitlement program, so the benefits are available to every person who's eligible, whether they claim them or not. Applying for SNAP, however, is difficult and time-consuming. So each year, $13 billion in SNAP benefits go unclaimed. That means that 9 million eligible families don't receive the money that they deserve to put food on the table. Technological innovations can make access to SNAP easier, but they can also further marginalize the poorest communities. In some states, you can't apply for SNAP benefits online, and in other states, you can only apply for SNAP benefits online, but both of these pose as barriers to access. So Relief designed our technology so that access to the internet is not a barrier to food assistance. By texting food to 74544, anybody in the US can see if they meet the basic requirements for SNAP using our screener. They can apply on a mobile-friendly website, or if they need one-on-one assistance to apply, they can schedule an appointment with a local community partner to apply completely over the phone, which about 50% of our clients do. Applicants can complete the entire process without using the internet or a computer. When we talk about technology, we have to talk about access. Today, Relief has connected over 1 million households nationwide to SNAP benefits. Adding technology to the safety net can be really simple. In Kentucky, we created a mobile-friendly SNAP application, which we found to be 30% more effective than the state's application because ours could be completed on a cell phone. The state's application had to be completed on a computer. SNAP is also very powerful in its reach. When MRelief started working in the state of Kentucky in 2019, 5,000 families in Louisville were being evicted each year because they couldn't afford their rent. The average SNAP benefit amount in Kentucky is $247 a month, which is more than a quarter of the average rent paid for a 2-bedroom home in Kentucky. Now, MRelief has helped over 5,000 families in Kentucky apply for SNAP benefits, which has opened a door to housing stability for them because for many families, using SNAP to buy food means that they can afford to pay their rent. Helen is a senior in Owensboro, Kentucky, who I spoke with and told me that before receiving SNAP benefits, she had to make the excruciating decision to go hungry so she could afford to pay her rent. She's still on a 2-year wait list for Section 8 housing, but SNAP helps her to afford healthy fruits and vegetables and still pay her rent. And she told me that food stamps made living in Kentucky a little more affordable. At MRelief, we believe in using technology to elevate people's dignity, and current systems strip people of their dignity time and time again. People shouldn't have to wait 45 days to find out if they'll be able to afford groceries. They shouldn't be required to find employment before they're able to afford to buy food. And we cannot give seniors $16 a month to eat and expect that to be sufficient. Some simple upgrades to the SNAP program were previewed this past year because of the pandemic. We waived the in-person qualification interviews. We extended the recertification timelines. We gave people the maximum benefit that they were eligible for. And we allowed people to buy their groceries online with their EBT cards. The impact of these changes has been tremendous, but there's still a ways to go. At MRelief, every day, we're thinking about the problem of hunger and coming up with technological solutions that help people afford to eat with dignity. I look forward to continuing this discussion with you and to share MRelief's vision for a human-centered safety net. As you work on these issues, remember that food is a human right. Thank you.
Thank you very much. Mr. Chen. You need to unmute. No, not yet, no. No, we don't hear you, no. So you know what, Mr. Chen, we're gonna come right back to you while we figure out your so we're gonna go to Mr. Gray and then we'll come back to you right after this. Okay.
Thank you, Chairman McGovern. Distinguished members of the committee, thanks for the opportunity to speak today. My name is Aaron Gray, and I'm the founder and CEO of Aunt Bertha, a public benefit corporation based in Austin, Texas. We created findhelp.org, a website that's used by millions of people and hundreds of thousands of social workers who assist others. Findhelp.org allows people to easily find and connect with free and reduced cost services that are provided by governments and nonprofits in the US. We're fortunate to live in a generous country with a strong safety net. My experience with the safety net began at an early age. I was born in the Martha Avenue housing projects in Olean, New York. From time to time, our family was able to eat because of the food stamp program, and we were able to eat lunch at school because of the free lunch program. I'm thankful for the safety net. The name of our company is inspired by my mother, who raised 7 kids and took in 2 additional kids for a period of time because they didn't have a place to live. Although she wasn't a social worker, she was a janitor, she inspired me to dedicate my life to helping others. We can't escape this life without having some curveballs thrown our way, whether it's caring for aging parents, losing someone close to us, or watching somebody we love struggle with an addiction. Although the public safety net, the large government programs like SNAP, Medicaid, TANF, and CHIP are vital to our core infrastructure, it's the hundreds of thousands of nonprofits that are serving the neediest among us every single day. The information age has given us some great advancements. You can order shaving cream while shaving and it'll be delivered securely to your garage the very next day. Yet, finding the nearest food pantry that is open and has capacity can feel overwhelming. We believe the confusion is from an abundance of options for people in need, and we believe that's an information problem that's solvable. So in 2010, our company set out to fix this. If we can fix the information problem, then the money we do spend on the safety net can be spent more efficiently. 11 years later, we've helped millions of people find and connect to social services. FindHelp.org is available for every zip code in the United States. Social workers from hospital systems, health plans, and nonprofits use our website on behalf of the clients they serve. Every one of us has a story of a time in our lives where we looked around and we said to ourselves, I don't know what to do. We help people during those moments. If someone finds a program close to them that they qualify for, they can just go ahead and connect electronically to the nonprofit or government agency that provides the service. And in many cases, nonprofits can quickly give the person in need the dignity of a yes or a no. Our team continually works to ensure that the programs showing up in the search results are up to date by keeping up with the ever-changing landscape of available services. We don't get everything right, but we get close. We protect our users' information, and we do not sell advertisements, nor do we sell their data. Before the internet, in both small towns and big cities, social workers have been doing this hard work each and every day. They still do. But up until now, we were not able to quickly understand where the supply of available services is meeting the demand for them. In order to figure out which programs to fund, public foundations and governments would spend months or even years using anecdotal information to figure out what's needed. Now, as this information continues to be digitized, the data tells a story of where supply is not meeting demand in near real time. For example, when COVID-19 hit, our data showed a dramatic spike in the need for a range of social services, from food programs to housing assistance. Food-related searches increased 326% from February to April, coming from our smallest towns and our biggest cities. Searches for non-emergency health services as a percentage decreased, as most people were putting off trips to the doctor. Digging in further, we can also analyze trends across locations and compare how our communities are doing. For example, based solely on search activity on the FindHelp.org network, we can identify states that do not provide dental benefits to adults on Medicaid, just because those citizens are more likely to search for free dental care. The point I'm trying to make here is that if we pay attention to these trends and work together, we can learn about trends in a matter of days and weeks and not months and years. That way, our government funding mechanisms that are already in place today can react more quickly and probably more efficiently with better information. If you're curious about what the trends look like in your states, I've included a summary in my written testimony. With new information available, we have an opportunity to envision a new safety net. The new safety net must be responsive, not just to trends, but to individual people, right in their moments of need. Government alone cannot build this new safety net. We need nonprofits, religious institutions, and the private sector. Imagine the possibilities of what a new safety net might look like. If we saw a dramatic spike in demand for food because a factory closed down, we could immediately speak with local nonprofits to ask them what they needed. Funds could be transferred in moments, and they could serve people right away. A new safety net makes it easy for people to raise their hand and say, I need help. The good news is this can be done. As a country, we've solved far more complicated information and logistical problems. As I was preparing my testimony, I was stumped on what my ask of you might be. I guess I would just suggest two things. First, I encourage you to think about the differences between the safety net as it is today, the one that helped my family growing up, and what a new safety net could be. Just using that language might help us evaluate whether the dollars we are spending today are helping as much as they possibly could be. Second, I don't believe the new safety net can be built by funding alone. If we want to make progress quickly, we can do it by getting the right people in rooms like these so we can share what barriers we're seeing out there. With your influence, we can move those structural barriers together. Thank you for the opportunity to share my thoughts today.
Thank you very much. And Mr. Chen, we'll go see whether we get you this time. No? Maybe take the earpods. I'm telling someone said take the earpods out. What the hell do I know? I don't know. No. What am I? All right, hold on. We're gonna. Okay. Okay. What we're gonna do is, I think we're gonna start some questions, but we're gonna come back to you. So don't go. We're gonna figure out whether we have to have you call in by the telephone or whatever, but we'll figure something out here. So just be patient with us. I know, Mr. Promoter, you have to go. Anything you want to add or before I move on?
No, just I want to thank the witnesses and yeah, I've got to run, but this testimony and the technology piece of this, let's take advantage of everything we can because this is such a big subject and I just appreciate this testimony and I'll yield back to you, Mr. Chair.
So I'm going to go to Ms. Ross next because I know she has to leave shortly.
Okay, thank you very much, Mr. Chairman, and thank you to everybody who's testified. And it's just another example about how we can use technology for the public good. I think lots of times when we think about technology, we just think about, the big tech companies, and showing how you can make technology work to help people is heartening, and I thank you for what you're doing. I do have a couple of questions, and one is, I'm from North Carolina, and we have a really big digital divide in North Carolina, and of course, that digital divide hurts and affects our rural areas, which again are the areas that are least capable of getting all the social services that they need. I've been to every county in North Carolina. I can tell you where you can not get an internet connection and where it's very, very difficult for kids to even be learning in the pandemic. And so I'd like to hear from you how you overcome those digital divides in these communities. And again, I think there should be a pretty strong correlation between some of the communities that need your services the most and the fact that they don't have the technology and the built technology to serve the people who need your help. So I open that up to anybody. I see Mr. Phillips is nodding his head, so maybe he should go first.
Yeah, and thank you, Congresswoman Ross, for the question. It's an excellent one. And there are two ways that we have found to kind of go at this. And this is why, I want to start with what technology can and can't do. And one of the things that we've actually found with our technology is that we've actually had to make it interface with offline processes. And what I mean by that is, you can't always put someone up on the screen like we are. But there are modes of technology that, are accessible in analog ways, like a cell phone. It doesn't always have to be a smartphone, but most folks actually have a phone. So one of the things we've figured out is how do you actually use texting technology, which you can do on an analog phone. How do you actually use the existing kind of infrastructure where folks are doing offline outreach, and then use that paper and use the technology that you can, like OCR scanning, and turn that into something that makes it easier for folks. So your question is exactly the right one, that, what we cannot do is just say here that everyone has broadband access, everyone has a smartphone, everyone has a tablet, everyone has a laptop. And we have to make sure that our technology not mimics what exists and doesn't work, but actually matches what does work. We know, for instance, in our home state here of California, promoters and community health workers are a big factor in access to not just healthcare, but just services. A lot of them also, can't use technology in the moment when they're at someone's door, engaging them around what do they need help with. So what we have done is make sure that the offline processes that they use match the technology tools that we actually have available. So if they do take a form from someone, they can just scan it in when they actually have the moment, so they don't have to stop. And it's also about making sure that we can reach more than just the urban areas. It's also those areas that, outside of, for instance, in Arizona, into tribal territory. 60% of that state is tribal territory. So we have to make sure that we have the ability to, work with the nations to be able to submit information into the state system.
Great answer. I have an answer, unless somebody else wants to add something. I have a question for Mr. Gray.
I'd like to just, if it's okay with you, Congresswoman, I'd like to just make one point on this, which is as the child tax credit is now, we're 30 days away from that, this piece about navigators and how we're going to need to make sure that we have folks helping to get people through the system, whether that's calling in and filling out a form, or calling in and creating navigators to go to an online system or an app. That piece will be absolutely critical for the success of a lot of these programs that are particularly reaching people who've never filled out forms before, whether paper or online. And so I just want to underscore what you're saying here.
Okay. And actually, I'm going to have a question for you in a second, but I wanted to, Mr. Gray said something intriguing to me. So, obviously one of the advantages of having technology is that you capture data that may show trends and may help you make policy decisions, help you change your approach in real time. And so, Mr. Gray, it's great that you can do it on the ground. Are there ways of collecting this data in a uniform way around the country to help us make policy decisions so that we can see what's going on? Have you moved from doing your excellent work on the ground to advocacy based on some of the trends that you see?
Thank you very much for the question, Representative Ross. This is my literally my first public hearing in life, but also as an advocate. I consider myself an advocate for the population that we serve, and we see some pretty amazing information, and we would be happy to share as much detail to help and to work with you on to how we could advise Congress, because we can drill in all the way to the zip code for everywhere in the United States in a secure and anonymous way. When you start to roll that up for the entire country, including some of the territories, there's a stark difference. And we'd love to partner with the data scientists that are out there, or with the CDC or other organizations in the federal government, so that we can analyze that data together and get into the right hands, so that those policy decisions and what to fund and what maybe doesn't need as much funding, but might have a better proposal or a better advocate. That's the vision of getting that information into the people's hands so that they can just build a more efficient safety net. And I'd be happy to partner in any way to share that data.
Okay, and then my final question just goes to tech and the next generation. And so I'm from a very STEM-oriented, I'm from the Research Triangle area of North Carolina, lots of science, technology, and math, lots of innovation, lots of tech. But what I'm seeing, the generation that got us here is a little bit different in terms of its values than this next generation. And the next generation very much wants to use its skills to act on its values. And so to all of you, how are you engaging young people, including, telling them that they can code for good, and to get them to say, boy, I'm in the science, technology, math area, but I can make a difference in my community. So do you, how do you get your helpers and your folks who are wanting to go out and be the technology bridge to solving hunger issues? Anybody?
Sure, I'm happy to jump in. So one of the exciting things about our brigade network, which is National Day of Civic Hacking that we launched with the Obama administration when we first started, but in general, we get together every single year, and that's really been one of the ways that we're bringing people into the fold of what can you do to use your skills within government, because many of those programs, or what we do on National Civic Day of Hacking, for instance, is we went across the country and did a project to tear down all the different social service safety net benefits. So we had everyone apply where they were to learn how quickly you can get through or not get through the systems and what the biggest barriers were. Just the act of bringing people into that made a real difference. The other piece for us at Code for America is we have apprenticeships and fellowships. That gets us on campus, that gets us in communities and says, come and join us for a year, for 2 years. And you really do get to be involved in some really cool projects in cities around the country. The last thing I want to note is I do tell young folks that 6% of federal employees right now are under the age of 30. Whereas in 5 years, a third of the workforce will be able to retire in federal employees. The government will be shaped by this new generation who is going into public service. I hope it lands, but it's also just frankly true. And so we're doing all we can in all these different ways, but we can't do it enough, to be fair.
Yeah.
If anybody has anything to add, that would be great. And then I just had one final thing to say, Mr. Chairman, and we can move on to other people.
Yeah, I'll just quickly add, similarly, tapping into the pipeline programs, but particularly those programs that are representative of the communities that have the lived experiences that are also engaged in STEM. And so one of the things that we are making available to folks, whether it's, working with an organization like Code 2040 or working with, the coding organizations, is having the conversation with the kids who want to do two things. One is, yes, they want to enter into a tech career and broad tech. Not just, I want to be a developer, but broad tech. But second, they actually want to do social change work. And so what we're allowing them to do is not just come in with coding skills, but actually come in with, a skill and, particularly for a number of the grad students who are young, a policy skill, and learn how to apply that to tech, which is one of the reasons why we're engaged with the pipeline programs. Because the most important thing for the young folks is they're tech native, and they don't have the same bifurcations that a lot of us have, particularly some of us who are a little older and started out as tech utopians and kind of had to move, right? They bring those things together. So what we've had to do in our workplace is make sure that we actually don't make it an either or proposition for them. And that we make sure that our developers actually have the ability to go into the field and allow those who are interns with us or fellows with us, see that experience, engage in that experience, and then apply it to the STEM career that they pick.
Okay. Thank you, Mr. Chairman. This has been great, and I'm going to mention it, and maybe we all can mention it to science, space, and technology as well. Maybe we can get some allies there. Thank you, and I yield back.
Mr. Chen, we're going to try you again.
How am I doing now? Can you all hear me?
Fabulous, like in stereo.
All right.
All right.
It would not be a technology hearing if there wasn't a technology problem, so I am happy to play that role and to check that box for you all today. Thank you all so much for the time, and apologies for the interruption. So good afternoon. I am Jimmy Chen. I'm the founder and CEO of Propel. We're a Brooklyn-based company that builds a free smartphone app used by over 5 million households across the country to manage their EBT cards, to conduct their banking, and improve their financial health. We work on a different part of hunger than the other esteemed panelists here today. We're not focused on enrollment, but rather on the 42 million Americans who have already enrolled and are currently receiving SNAP benefits. I'm honored to join this roundtable today to discuss how technology can help fight hunger. I believe that software alone cannot feed families, and it cannot end poverty in the United States. But I believe that it can build tools quickly to respond to the needs of consumers. It can do a great job of distributing information, and it can reduce stigma. So as such, technology has a major role to play in our fight against hunger. The desire to build new tools quickly and to have them used by a lot of people at once is what drew me to technology in the first place. I grew up in a family that had its financial ups and downs, was fortunate to go to college on financial aid where I learned how to code, and I ended up working at several high-growth software companies in Silicon Valley. It was in Silicon Valley that I came to realize that people solve the problems that they understand. Most of the technologists and entrepreneurs that I worked with understood the challenges of being a 20-something male who lived in a big city, but not a lot of them understood the challenges of a single mother trying to feed her family on SNAP benefits. However, nowadays, that single mother probably has a smartphone and probably uses it consistently to access the internet. So there is a need for more organizations who understand her challenges and build software specifically for her. I'm really fortunate to be joined on this panel by 4 others who see it this way too, and I think you all, as a group, really do believe this as well. When I set out to start a company, I focused on talking to low-income Americans directly. One of the experiences that I came across was somebody going to the grocery store to spend her SNAP benefits and checking her EBT balance by calling a 1-800 number. I naively asked, I don't have to call my bank to check my balance there. Why isn't there a mobile banking app for the EBT card? That led us down the path of building that app, which we originally called the Fresh EBT app, that have since renamed Providers, that replaces that 1-800 number with a free smartphone app that works kind of like a mobile banking app for the EBT card. We really see EBT balance checking as an on-ramp towards greater financial inclusion and financial health. So in addition to being able to easily see your EBT balance and transaction history, the Providers app comes with free mobile banking, which enables free direct deposit of cash benefits like SSI, TANF, and the upcoming child tax credit. It also contains features focused on helping people save money through grocery coupons and earn money through job postings. Our users have saved over $60 million through the coupons feature and applied for over 200,000 jobs. Providers is free for end users and governments. Our paying customers are the retailers who pay us for coupons clipped and the employers who pay us when people apply for a job. We launched this app in early 2016. Providers is now used by over 5 million households each month. About 1 in 4 Americans who receive SNAP benefits uses the app regularly. About 2 million people use the app each day. The development and scale of Providers is an example of the ability of modern technology to build new tools to rapidly address the consumer pain point. We also believe that technology can be a uniquely powerful tool for distributing information rapidly, especially in times of crisis. Because Providers is a trusted source of information for these 5 million households, we've been able to distribute new information to SNAP participants as programs change. We maintain up-to-date information about programs like PEBT, eSNAP, WIC, summer meals, and more within the Benefit Update Center, which reached over 8 million households last year. But we don't limit our information to nutrition. When the IRS released a tool for people who hadn't filed their taxes in order to receive the first economic impact payment last spring, we shared that information to our user base, many of whom were below the income threshold for tax filing. Over 3 million people clicked the information that we shared, and that enabled many families to get the $1,200 stimulus payment that they were entitled to. Propel has also distributed cash grants directly to its users funded by private philanthropy. Last year, we co-created Project 100, where we sent $1,000 cash grants that were funded by private philanthropies to families during the pandemic. We were able to send over $140 million in cash grants to SNAP participants that we identified as being in financial need through the Providers app. Technology can also reduce the stigma of using safety net supports to make ends meet. I believe that the opposite of stigma is respect. And when a technology system doesn't respect the time and the circumstances of the people who use them, that's what creates stigma. Social benefit systems are still too often these walled gardens of technology that don't follow pro-consumer best practices. And in my written materials, I shared a few specific ways in which that could be addressed. On the subject of stigma, I did want to share a quote from one of our users, Marge in Florida, who said, "Providers is easier than having to call and put in your card information to get your EBT balance. You can be at the store. You don't want to be embarrassed. It's like the best thing in the world. In an instant, you can get your account information and balance." Being able to play a small role in reducing the stigma of the program is why we do the work that we do. So thank you so much for your time and your invitation today. We're proud to apply technology to fight hunger day in and day out, and would love to discuss ways we can partner to continue making technology meet its promise for everyone.
Terrific. Thank you very, very much. And I want to now turn to Ms. Scanlon.
Thank you, Mr. Chairman. These discussions are always really eye-opening in terms of just the whole range of things we can do to reduce hunger in this country. With the social distancing required by the COVID pandemic, I think it's fair to say that we saw very, very starkly the potential impact that technology can have on everyday life, as well as the gaps that emerge when people don't have access to that technology. Technology became the primary way that many people connected to school, work, family, friends, healthcare, and vital information and services and jobs. Ordering online and grocery delivery became part of that. And early during the pandemic, we began to hear from constituents who were anxious to use their SNAP benefits for online ordering and delivery. These were usually elderly, immunocompromised folks, or just folks who were wary of venturing into the store for groceries in the midst of a pandemic, which we did not yet well understand. So thankfully, Pennsylvania and many other states began participating in the SNAP online purchasing pilot program, but only a few retailers are currently approved. Many of our small local retailers are not eligible to participate. And one of the issues we ran into was how we could possibly use technology to connect food insecure people to local farmers markets, both to ensure access to healthy food and to help farmers weather the sudden disruption to their supply chains that were caused by stay-at-home orders. Many of those markets wanted to offer online ordering and delivery to SNAP customers, but were unable to. So Ms. Bain, could you speak to the benefit of expanding SNAP online ordering to more SNAP retailers and removing delivery fees?
Absolutely. Thank you so much, Representative Scanlon. I think that the benefit of expanding these online retailer programs to accept EBT can really mean propping up local farmers markets, farm economies. And I don't know the solution for how local farmers markets can do online delivery for individuals seeking to access local fruits and vegetables from their markets, but I do think it will have an incredible impact on the health of individuals and also allow them to access a local grocery store or seller that can provide fruits and vegetables to them. That's not an Amazon or a Walmart or one of these big chains that exist nationwide. So,
thank you. Ms. Renteria, you mentioned in your testimony that you're currently working on efforts to improve SNAP outcomes in Pennsylvania. Can you talk a little bit more about those efforts?
Yeah, we're actually doing a lot of data analytics. So a lot of the conversations, not only are we able with technology to be able to put resources out there, but we're also able to help states understand what are the biggest barriers in your systems. And so that's really what we've been brought on board for, is when you see those gaps, how do you look at the data and understand, is it our data matching problems? Do we need to do notification? Are people dropping off when they have to recertify in order to get that next benefit, which is a big piece? But we're using data to really help the state go through each of those different lists about what is it now that we can do and what are the biggest barriers, and let's focus there. The idea is we take one at a time and just move on down until that gap closes.
Okay. Mr. Chen, you said something about using technology to reduce stigma, and that really stuck with me. When I was on our local school board, we moved from a paper system for school lunches to going online, and so that everyone could have a PIN to access the school lunches, so there were no more of the cards that used to stigmatize the kids who were on the free and reduced lunch program. So we certainly saw that in practice. How can we do that perhaps with SNAP benefits or anything? Do you have suggestions there? And then I would ask the same question to Mr. Phillips about how do we overcome these inequity and stigma barriers?
Well, thank you for the question. I think the SNAP online purchasing pilot that you just described is a fantastic example of the way that the SNAP program is reducing stigma day over day and is moving into sort of more of the consumer mainstream experience of putting food on the table. Our data shows that about 12% of EBT cardholders have made an EBT online purchase recently. So the program is growing. We do think that the number one challenge facing a lot of families is the delivery cost. The fact is that SNAP benefits can't be used to pay for the delivery fee when purchasing online. And so there are still some fundamental, and practical questions around how is this program really going to scale to sort of meet its full promise? Because I think at its full promise, that's really where we see really the full reduction of stigma, in the sense that paying with an EBT card should be just the same as paying with a credit card or a debit card somewhere else.
Yeah, although I know we've heard in other contexts problems with delivery systems gouging. So we're hearing a lot of that from the restaurant workers, or the restaurants. So I guess that becomes an issue. How about you, Mr. Phillips? Did you have anything to add about the use of technology to reduce inequity and stigma?
Yeah, so this is actually an area where we can directly go at inequity, and this is where, particularly for Congress, reuse would actually be one object lesson. So I'll just tell you, in the state of Arizona, where we're the system of record for both the SNAP system as well as the Medicaid system, there's about 2.2 million people enrolled in Medicaid and CHIP, and there's about 800,000 enrolled in SNAP. as you all know, the eligibility for the programs are almost identical. But that disparity in enrollment is an example of what we're actually talking about, the gap between interoperability. So if you had robust interoperability protocols that allowed us to implement, as outlined in ACA section 1561, the ability for these two systems to directly communicate. Many food insecure folks who are also enrolled in Medicaid would have a direct pipeline to automatic eligibility enrollment when they actually applied for Medicaid or even applied for subsidized coverage through the FFE. And it would allow us then to just treat them just like we treat everyone else. And so another example I'll give you is, we've been working on a program in WIC where with SNAP benefits, there is the pilot to allow folks into getting access through online providers and a grocery delivery, but not for WIC. And so the equity question would be, how do we make sure that for all of the folks who are similarly situated, just like someone who's Medicaid eligible, that they would be SNAP eligible, that we can actually close that gap, that we would do the same thing in all of the programs where people are similarly situated. And I agree with you, what we should not be doing is using this to, pay the membership fees of, online grocers and online kind of food delivery systems. But what we should be doing is allowing them to treat anyone who actually has the means, whether it be through a public benefit or just a regular consumer. And we just saw this during COVID, have the same access as anyone else.
Okay, thank you. That's very helpful. And I think my time has expired, so I will yield back.
Thank you. Mr. DeSaulnier.
Thank you, Mr. Chairman. This is a terrific hearing. Mr. Permelter and I have decided that you're the Eliza Doolittle of the committee, although I understand the Worcester dialect perfectly. And I really have so many questions for the panelists, terrific panel. But maybe start with Ms. Renteria, if I'm saying that properly, Mr. Phillips or Mr. Chen, if you want to jump in. During the recession, I chaired the budget subcommittee in the state Senate in California on health and human services, in good part because no other members wanted to do it. And at that time, California, although we had the most number of participants in SNAP, we had the lowest participation rate. And that had been multiple administrations, both Republicans and Democrats. It was a great source of embarrassment and frustration. One of the things I discovered was our procurement process, when it came to technology, ironically in California, was very poor. And what I spent a lot of time with eligibility workers and caseworkers in the county I represent. I used to be a county supervisor. As you know, in California, we delegate these from the state to the counties. But they were so overworked. So the technology was oversold. And granted, this is 10, 15 years ago. But the caseworkers really struggled, and a lot of them retired and quit because of it, because the RFP didn't include enough training, and the technology, in my view, was oversold. So the administrations were telling them their caseload would be easier because the technology would make it easier. In reality, what they were doing was they got frustrated and just kept writing out like they had done for decades. And then at the end of the day, on their own time, frequently they'd go back in and try to load it on their computers so that they wouldn't get in trouble. Having said that, I know we've done better in California, but this is an important issue, I think. If we want to really do some good work on this and follow through on the chairman's leadership, we got to provide thoughtful infrastructure and not overpromise on the technology. So I wonder, your experience, Ms. Renteria, really speaks to this, I think, is being realistic about the deployment of the technology and the support for caseworkers and eligibility workers who are oftentimes overworked, so that they can transition, understand and implement the technology in a thoughtful way. Because one of our participation rates in California, I really think, in those days was because the eligibility workers and the county social service workers, our department heads actually didn't want to deal with it because their workforce was so overworked. I wonder if you could respond to that and how much better we're doing now, if you could inform me on that.
Sure. So a couple things. One is, I think the way state governments has looked at technology is this big vendor contract that's going to be the right silver bullet answer. And what we all know in being in this space is you've got to go through the process and iterate, sit with caseworkers to understand what they're going through on a day-to-day basis. Exactly what we're doing in Pennsylvania right now, where we're sitting with folks going through what are the barriers, and then really you're looking at it from the caseworker's view and being able to say, okay, what can we move? But that requires technology contracts to be able to have an iterative space where you're actually working in conjunction with public servants. And it's really what we do. It's why we don't do big vendor contracts. We actually sit with folks and go, what do we need to do? Sometimes we'll help on vendor contracts so that they have that kind of clause and that kind of training within it. What I'll say about the state of California is we saw the same thing. That's exactly why we started Get Cal Fresh, is because we could see that it wasn't working for caseworkers. It wasn't working for people who were trying to receive the benefits they needed. Where we are now in the state of California is that the systems are coming together. California has 3 different systems. And so some of it was that you were trying to navigate that, but it's also about the training that is happening within the state of California. There is now a human-centered design center. There's a chief innovation center as well. That is all about making sure that there is tech talent within the state to be able to do the kind of work that we're now seeing really be done across the board. The last point I'll just make is we do have to start thinking about technology, not as the help center or in one place, but technology each and every program area, each and every department, and how it's actually seen through the eyes of the customer and back through the organization. So I really appreciate the question.
Mr. Phillips, you have anything to add, or Mr. Chen, or any of the panelists? Thank you, Ms. Renteria. That's really helpful.
Absolutely, Congressman. I echo everything Amanda said, and just add a couple additional things. The processes, while they're modernizing, they're still kind of firmly lodged in traditional methods. And so while there are things that are beginning to inform it, the actual procurement process itself still operates much like it did 20, 30 years ago. And so if you consider organizations like ours, who actually take a more kind of what I would term, what Amanda called as a radical incrementalism approach, where you take small things before you do the big whiz bang kind of implementation, so you know that it works, but you also incorporating the operational and technical know-how of the frontline workers, because that practice should inform it. We don't necessarily see those practices actually inform the requirements that come out in a procurement. That's one. The second is that the procurement also still has practices in it that don't necessarily consider kind of diversity of thought. And most of them are about political protection. And I understand it, right? That there are tens of millions of dollars at stake through these processes, as well as, there's, a representation of how democracy should work when we actually do this. So I understand the protection approach. What it results in, though, is a small number of vendors continually pushing through practices that don't actually allow the innovation that we're talking about here. And it doesn't allow something that Jimmy talked about, which is the perspective of the end user to actually come forward and what it is you actually want to procure. And the end user, in our opinion, is both the worker who has to provide the service and the person who's actually asking for that service. We have yet to kind of modernize the procurement process to actually see that show up. And it's one of the reasons why you actually just see a handful of vendors in our space really dominate. And a number of states really struggle to find, different alternatives to what they're currently doing.
I really appreciate those comments. In our case, most of the workers were represented by AFSCME. I engaged AFSCME very much in this process. And I must admit there was a cultural thing to your observation about politics, where the administration just thought, oh, they're just trying to renegotiate and open up their contract. When no, this was actually, from my perspective, a real incident of workers trying to express themselves, that they didn't have the resources in the contract from the contractor to do their work. And these were all people who were, most of these people were dedicated to what they were doing, which was a real shame because they gave up. Mr. Chairman, I just want to thank you so much for this. I'd love to work with the panelists and you on what are best practices, because if we don't get the infrastructure right, we aren't able to do the vision that you have and actually get these services out to the families that need it. And it's a challenge, but I think it's a challenge that can be accomplished with your leadership. Thank you so much.
Thank you. And I appreciate the panel and all your insights because, you know, as we talk about how we address issues like hunger, for example, it's more than just about, you know, increasing the benefit of SNAP, which I want to be increased because it's inadequate the way it is right now. It's more than, you know, just about WIC. It's more than just about school feed, right? And, you know, it's about connecting all the dots. And it seems to me that technology is one of the ways to connect all the dots. But each of you is describing a value that your company is adding to improve the lives of people living in or near poverty that is currently not a fixture in the system. And that's dignity. And each of you have talked about the importance of dignity, meeting people and families where they are, designing products that work to lift them up and connect them to services. Now, there are some in Congress, some of our colleagues in this wonderful place, who might say, look, you know, we built it. It's their responsibility to come and apply. You know, the ball's in their court. So what are the problems with that type of thinking? Because I want to get this on record. And what problems or inefficiencies or inequities does that type of thinking create? And I will go to everybody here, but we'll start with Mr. Gray and just kind of go around my Hollywood Squares panel here. But Mr. Gray, we'll begin with you.
Thank you very much, Mr. Chairman. Well, I think sort of we've built it and sort of leaving it up to everybody to sort of navigate themselves. I think the primary flaw with that is a lack of understanding how complicated it is for people in need to actually figure this out. In all the talk about technology, really, how do we empower citizens to be sort of citizen social workers? And I think that's the core issue here, meaning, you know, we're seeing social work not be as an interesting of a career, and you know, the pay isn't as high, and they're not really necessarily glorified as heroes, but they really are heroes. And so through technology, I guess I believe that if we can simplify processes, then we're essentially creating family members who act as their family social worker and can navigate and you know, help their nieces and nephews who might be struggling with an addiction. And so I don't know that you know, sort of those that you reference would disagree with that. I think the question then becomes is this a government problem or is this a navigation problem? And I would probably you know, +1 on you know Ms. Main's comments about and also others about opening up ways for people to apply just through pushing applications to get that dignity of a yes or a no from the state agencies. Just setting some standards on a national SNAP application, and let's just pick one, and really the federal government getting behind it. The innovators like, you know, Mr. Chen and Ms. Main and Mr. Phillips, they'll step up and they'll do it, whether or not there's sort of consensus, you know, among the federal government. I really believe that.
I'm going to go to Mr. Phillips next, but before I do, let me just make one observation. Another little quirk about this place is we have programs like SNAP, which are designed to help people, but yet we have people here who are working overtime to try to make it more difficult for people to apply because they don't want the rolls to go up. And as I always say, you know, SNAP is like one of these programs that's kind of counter-cyclical, right? If things get bad economically, more people qualify. We want them to be able to enroll because we don't want people to go without food. When the economy gets better and people don't need it, then fewer and fewer people on. I mean, a few years back, we had this thing called categorical eligibility was introduced. It was actually a conservative idea, you know, that to streamline all the bureaucracy and to make it easier for people to enroll. So if you enrolled in a program like LIHEAP, you'd automatically be enrolled in SNAP or vice versa. Now people are saying, oh, what a disaster, because more and more people are enrolling in the program. So, you know, there's this, you know, we have these programs that are, again, designed to help people, and yet we have some that I get the feeling are working overtime to make it more difficult for people do it. But anyway, Mr. Phillips, I'll turn to you now.
I absolutely agree with what Aaron said, and I would add an additional complicating factor, which is it's not just that, there's either a fiscal conservative kind of streak around restricting people on programs, or government putting the burden on the individual to kind of figure it out. That comes from a place that we actually need to acknowledge, that we talk about these things in the present tense, but there's a history of how these things have developed that are inextricably linked with how our modern day patchwork of safety net programs function. And whether it be the mother's pensions programs that started in the 1890s that were the precursor to AFDC, which is now TANF, or whether it's the way that New Deal programs actually set up the Social Security Act and left out large segments of the population, or even the narratives in the 80s around, the welfare queen narrative and racialized welfare form and workfare programs, which carry on today. There's a perpetuation and exacerbation of this inequity that puts the burden on the person. And it puts that burden on the person because there's a view of them. And we do this without examination of how history has actually been used to drive norms and standards that actually make it hard for folks. And we've disguised it over time under terminology like work requirements and family caps and drug testing and resource limits. And while this Congress and this administration is doing yeoman's work and yeoman's work and dealing with that, most of the programs are administered in a way that are fundamentally rooted in that type of paternalism. And, dare I say, kind of racism and oppression. And there's been a long history with all three. And so ultimately, we're framing access to benefits in terms of deserving versus undeserving. And it relies on a narrative about people who need help that puts the burden on the person who actually needs help and not on the institution to provide it. And it is something that we have to face. It is a paradox that we actually have to face if we're going to address all the other things that technology could actually be a wonderful thing in addressing. That the soil in which we're actually talking about these issues is the thing we need to deal with. And then we need to talk about the tools on how we actually accelerate dealing with things like poverty and hunger.
No, thank you. And I agree with your assessment. I mean, I've been around for a number of farm bills now. And when it comes to debating SNAP, for example, we have people that want to add all these work requirements, all these hurdles, drug tests. And I remember getting in a debate with one of the people who was proposing that, and I said, well, I mean, why do you look at SNAP? Why does it have to be? Why do you view it as a punitive program? I mean, people who are on SNAP, on any of these programs are on it because they need a little extra help to get through this. And he said, well, it's taxpayer money. I said, well, you know what? Your salary is paid with taxpayer money here in the Congress. Maybe all of us should go out and urinate in a cup and see whether we're on some sort of drug. Maybe that might explain why we do some of the things we do up here, because it's quite frankly, I mean it's this diminishment of poor people, of people who are struggling, of people who are having a difficult time making ends meet. Life is hard enough. I mean, we've been meeting with a lot of people with lived experiences as we talk about some of these issues. And I'll tell you, I mean, it's amazing that people have the time to even breathe because they're managing so many things, whether it's raising their grandchildren or taking care of a sick relative, or just trying to make sure that there's food on the table, and to have government make it more difficult or add to the stigmatization, it's not right. Mr. Chen.
Well, I just couldn't agree more that about the role that SNAP plays in the social safety net and in putting food on the table for a lot of families. I think it was put into even more stark contrast for us over the past year during the pandemic. At the worst point of the pandemic, for people that we served at Propel in December 2020, about 46% of our users said that they ate less. 44% told us that they decided not to pay a bill, and 60% were borrowing money or used credit to cover expenses in the past 30 days. And so that was, and like, you know, these are folks that are already able to use SNAP. Now, the silver lining to this is that we saw that when interventions like PEBT and the economic impact payments came out, they really did make a large amount of difference for a lot of families. That those numbers dropped really precipitously over the next few months because these social safety net supports worked in just the way that they were intended to help families make it through a time of crisis. And as we see the economy start to recover and fits and starts, we are starting to see those numbers come down from their highs last winter. And so I think, you know, from our point of view, that is sort of the data side of your point around SNAP being a countercyclical program, the role that it plays in a lot of families' lives, and how important it is that it remains strong so that when situations like this happen, it is able to be responsive. I would also just add, you know, to the point about, you know, sort of perceptions about accessibility of SNAP and whether or not to make it accessible. It is our view that making something accessible doesn't mean it has to cost more. In many cases, it costs less to use different types of technology to modernize the infrastructure so that people can be seen, you know, through a mobile app or through a website instead of through a caseworker. In our case, in the EBT world, there are also ways to save money and make that system a lot more efficient through technology. And so making the system more accessible to people doesn't necessarily mean it has to cost more. It just requires that people really listen to consumers about what their needs are and to actually care about those things.
I just moved around on my screen. So Ms. Mine, and then I'll go to Ms. Renteria. So Ms. Mine, why don't you begin?
Thank you. I think there are a couple important points to make that really demonstrate the impact of this disparity, which is, again, 9 million individuals in this country are eligible for SNAP but not receiving it. So that really just speaks to the tremendous problem that access to SNAP is. So these systems were not developed with the human dignity in mind. So I think that really just demonstrates the gaps in this program. And I think a lot of those people are working individuals, so they just simply don't have time to manage their jobs and still apply and complete a really burdensome application process. But regardless of whether they're working or not, people are experiencing tremendous stress just being in poverty. And I think it's unconscionable that we would expect people to first find a job for 20 hours a week before they're able to afford to eat. I think that's really difficult for people to do. And I'm really, again, we believe that food is a human right. So I think that we need to make these systems more accessible for everyone, regardless of whether they're working or their background or where they live, where they're from. So.
Ms. Renteria?
Yeah, there's been so many great comments here about what we could do. And I just want to underscore the lived experience part. When I hear someone say, what's the problem here? What that speaks to me is they haven't actually gone through the system. It would be fantastic to have a CODEL where people actually go through a social services office and try and apply to some of these programs and get a real sense of what you have to go through in order, and what people do go through in order to try and just eat. I think that's a piece that's really missing here. The other thing I would say, and I think about quite often, is there is never the trust in government right now in our institutions, whatever you're talking about, is at one of the lowest levels. We have to be able to say a policy was put in place and then it was implemented and it worked. And I think that's part of some of the message here. And then the last piece I would say is, I think a little too often we talk about it as these programs are filling a gap, as opposed to these programs are launching potential. And I think we've really got to start thinking about these communities, these folks that we are helping, these folks that have been invisible, and we're bringing them into sight and making sure they have the basic needs in order for these kids to be able to do well in school and to do whatever they want to do in the future. And that's the story of America. And so in some ways, I think we've got to figure out ways to tie that narrative, to have people understand what folks are going through, and then together make it better.
Thank you. So I see that Congresswoman Jen Schakowsky of Illinois has just joined us. She's actually on the Energy and Commerce Committee. Jen, I don't know if you have anything you want to add or ask at this point, or.
I wanted to add to something, an experience I had. I went with a friend to the Social Security office, and I had to use the restroom, and I had to go up to a woman at the table and ask for toilet paper in order to go into the restroom. Talk about lack of dignity. And of course, you only got like 2 squares to go in. Why? Because people were walking off with the toilet paper, and they had to protect that. That's gone now, by the way. I threw such a hissy fit about it, that policy was a state thing. I think it was a state office, so I'm not even sure. But that kind of thing, treating people like that, you know, I had a wonderful staffer at one point who said to a disrespectful deliverer of service, do you understand that you are here because of her? If not for people needing your help, you wouldn't have this job. You know, I mean, just there's we have to just make sure that the culture is respectful. And I think the way to assure that is for members to show up and go and see how people get treated and demand dignity. I don't know, you just when you said that, it just struck me how demeaning that experience was.
Well, we were just, before you get on, Jim, we were talking about just how it's hard work to be poor in this country. It's a full-time job. And when you hear people try to, diminish the struggle of people, or, try to say somehow that it's easy street if you are in poverty, it's an illustration of the fact that we have a lot of people in powerful positions who just have no clue.
No clue.
And I've said, you can get elected to Congress and probably never have a conversation with anybody who's on SNAP if you so choose. You can get elected to Congress and, never go into a social service agency. You get elected to Congress and never have to talk to anybody who really struggles. And I think, that's just a sad reality. But look, part of the deal here is if government's not here to help people who, struggle, then I don't know what the hell good government is. So, part of what I think is helpful here, and I hope that the panelists will continue to, to be available to us is, again, our goal here is to now is to connect all the dots, right? We want to end hunger, but we know there's a healthcare aspect to this. We want to end hunger. We know there's a housing part of it. And hunger is, and technology, by the way, is a way to kind of help us connect the dots. And so our goal is to get this White House conference up and running, hopefully next year. And what we want is not a White House conference that's a press conference to tell us all that we have a hunger problem in the country. We got to do something about it. We want a White House conference that says, okay, here is how we can actually solve this problem.
Absolutely.
And that's, and the more and more I have, and I think Jan would agree, I mean, as we deal with social service agencies, as we work with people with lived experiences, I mean, there's so many things that are disconnected that make it really difficult. And by the way, technology can help, as was Mr. Chen and others have referred to, help reduce stigmatization, which is a real problem. Jen, I have a question. Do you have a question you want to ask, or should I go on?
Yeah. Well, can I ask a question?
Sure, go ahead. Yeah.
I think I don't know how to pronounce M-E-Y-N. Is me?
Mine.
Mine. You're from the Chicago area, right? And I appreciate. I just caught the end of what you were saying and the tremendous compassion and how hard it is to find a 20-hour job in order to, I mean, I'm on the budget committee, and I want to tell you the contempt that I see dripping from the lips of some of our colleagues in the Congress for people who are poor. It's as if they believe if you're doing well, if you're rich, you deserve it, and if you're poor, you deserve that too. And so you better get off your lazy butt and go to work if you want any of the taxpayer benefits. And the more I think we can, and I like the idea of diminishing the, to make the stigma go away. But I'm really interested in what you're doing in Chicago area, and thank you so much. And sorry that I got on late. I was a keynote or at some other conference. I just appreciate all of you and the attitude as well as the work. I chair the Consumer Protection Subcommittee that in the Energy and Commerce Committee that deals with issues of technology and how technology is used and the responsibilities of platforms, et cetera, privacy, but also, maybe offline if you've already done it, back home, learn more from you about what you're doing in the Chicago area. I just wanted to say that.
Thank you. And I just wanted to just share one anecdote as well in the state of Illinois, just to point out that people are trying. They're trying to access these benefits. The system exists, but they're not able to do so. I spoke to a woman early on in the pandemic here in Illinois who she was so relieved to be able to talk to someone on the phone to help her go through this process after she had called the state SNAP hotline and learned that she was number 193rd in line to speak with a person. I have no idea how many hours that would mean she would have to wait, but she was trying to get benefits, and just the existing system there just wasn't working for her. And so her options were to look elsewhere. And I'm glad that MRelief was able to provide her with access. But for many millions of people, for 9 million people, they don't always have options to enroll and apply. So thank you.
And Jim, I just have to say to you, from the moment I stepped into the Congress, you were the hunger fighter. And I know that's been your life's work in many ways, lots of other things too, as chair now of the committee here. But I just thank you so much for your persistence in fighting this fight to make sure that Americans in the richest country in the world are not going hungry, as well as people around the world. I know you work on that too.
Well, I appreciate that. And one of the reasons why the Rules Committee is doing these hearings and roundtables and site visits and, and pushing for this White House conference is because one of the things I've learned, I think Jan has learned as well, is that we talk about this issue, it doesn't fall neatly under one committee. I mean, I see Mr. Dutanier on the call as well. I mean, if we're talking about SNAP, we're in the Agriculture Committee. We're talking about school feeding, we're in the Education and Labor Committee. We're talking about hunger amongst our active duty service members. We're talking to the Defense Armed Services Committee or the Veterans Committee. And so same thing in the administration. So when we talk about how we deal with this, it's like, everybody has a little piece of jurisdiction, but nobody pulls everything together.
Together, yeah.
Right. The nice thing about the Rules Committee is we have no rules. Right? We can do whatever the hell we want to do. And so we are serving kind of almost as a select committee on, like similar to the select committee on nutrition and human needs that existed in the Senate several years back. And so that's, and there's lots of really innovative, and you have highlighted some of the innovation going on, right? There's stuff that, like, God, this makes sense. Let's expand it. Let's do more of it. Let's figure out, ways to build on it. And that's kind of the goal here, right? And And so, so this is important. I just have one question, and then I'm going to give you all an opportunity if there's anything that you want to add for the record. But Mr. Gray, Dr. Thea James from Boston Medical Center, she testified at our very first hearing related to this anti-hunger project that we're engaged in, and she was and is amazing and truly inspiring. I think all of us were wowed by her testimony. But BMC uses Aunt Bertha on site to help address challenges through the hospital system, but also in the ER related to opiates and other substance use disorders, food insecurity, homelessness, basically the social determinants of health, which negatively impact health outcomes for people and financial bottom lines for the healthcare system. So Mr. Gray, and then anyone else working in the healthcare space, I'll let you give your answer, and you can add whatever you want that we haven't asked. But how does Aunt Bertha act as a tool for doctors to help better serve their patients?
Thank you, Mr. Chairman. And Boston Medical Center is one of our favorite clients, so thank you for the mention there. We work with most of the hospital systems in Massachusetts and certainly around Boston. And so many folks are really interested in people's basic needs being met, because if their basic needs are being met, they're less likely to consume a lot of hospital services. And if your rent's paid and your air conditioning works and you have enough food, you're actually less expensive, if you will, to insure. And many hospital systems and health plans across the country believe this, and there's a term for it, which is addressing the social determinants of health. So what's happening is organizations like Boston Medical Center and others are hiring social workers, care coordinators, and training their staff to assist patients when they're within the walls of the hospital system, to get them set in the right direction. In some cases, our software is on kiosks right within the emergency rooms around the country. And so if the idea being is if while you're talking to that patient and you find out about a need, maybe there's something that you can quickly do about it. And our software makes it easy in order to do that. The other really important part of that is if the system's easier to navigate, the patient's more likely to, maybe they won't bring up something to their doctor or to their social worker at the hospital system because they might be embarrassed. But our customers and many of these wonderful institutions we work with are giving little 4x6 cards to take home with them. And when they're home, they'll start searching for things like, I need help paying, feeding my family. And it gives them that dignity of self-service and that dignity of beginning the process where maybe it's just getting a temporary help from a food pantry. And so we're lucky to have partners in many hundreds of medical institutions and systems across the United States, just like in Boston. And it's a real important part of solving the costs of healthcare, this exact issue.
Thank you. So in other words, what you're saying is that doing the right thing, helping people, is not only morally the right thing to do, but it's actually cheaper. So if you don't care about helping people and all you care about is the bottom line, that people ought to sign up for what all of us here were talking about. But again, I appreciate it. Let me, I'm trying to look on my, you all keep on moving every time I look at the screen, but let me just kind of go. Ms. Renteria, if you have any final thoughts and things that you want us to come away with. And again, we're going to stay in touch with all of you because I want you to be part of this White House conference. I think that you have some knowledge and some information here that I think is that needs to be part of how we solve this. So I'll let you have any final comments you might want to make.
Yeah, I'll just end with one piece, which is we are what we measure.
Right.
And we've got to make sure that as we start to talk about safety net, or we start to talk about the child tax credit, as we look at these programs, if we can start to really measure, are we actually closing that gap? Are we reaching communities who haven't been reached before? That conversation and really that mandate really does change the way governments start to look at the way they do these programs, whether it's technology or processes or the people they bring in. That very key piece we are seeing it make a difference when the federal government says we want to see equitable outcomes, when the federal government says we want to see you close that gap. And so I'll just leave you with that. And we are excited to be a part of this conversation now and as it moves into the future and to be helpful in any way we can. So thank you so much for having us.
Thank you, Ms. Mine.
Thank you so much. I just want to say that these solutions can be really simple. One of the things that I mentioned is just the ability to text to find out if you qualify for SNAP benefits. The technology exists, and it doesn't have to be overwhelming to bring it into the social service space. Really simple, small integrations can allow so many more people to access these life-saving benefits. And MRelief is here, and we're happy to help in any way that we possibly can. So thank you so much.
Mr. Phillips.
First, just thanks for having us. And I'll just say, we're down to participate in whatever way folks need us. The thing I want to leave us with here is whether it be the policy conversation or it be at, the administrative kind of conversation, there's one thing, particularly in the last part of this conversation, that I don't want us to forget is that, people-centered rather than program-centered is actually the thing we really got to be talking about here. Because that's what facilitates things being simple and easy. That if we have a people-centered kind of approach, and I'm talking about as a policy culture, as an administrative culture, the technology that we use will help us approach these programs from a perspective of meeting the multiple needs of people. And as you all just pointed out, and I'm talking about both on the worker side and on the person seeking the help side. And it's something that has been pointed out a lot here. Rather than focusing on whether someone's an applicant or a client who's eligible for a particular program for which they express interest, a person-centered approach here will connect people to all the things that they actually need to address hunger and poverty. And as you pointed out as a policy question, that's not just a SNAP question. It's not just a Medicaid question. It's not just a TANF question. It's not just a school lunch question. It's a person question. And that's the same thing at the administrative level. And that's the only way our technology actually really helps. That if we actually take that perspective and it supports that type of culture.
Thank you. Mr. Chen.
Thank you so much, Mr. Chairman. I just wanted to note that there's a mix of for-profits and nonprofit entrepreneurs on this call, and that I believe that that's actually an important component of what the answer here is moving forward. That it would be in particular a mistake to exclude for-profit organizations who have a unique set of resources to contribute to the fight against hunger. I mean, I really see it as it's not about tax status, it's about commitment to serving a certain type of consumer and faithfulness to the mission. At Propel, we're a for-profit company, and as a result of that, I think we can be quite nimble in terms of how we serve consumers and what needs we're responsive to. So we've helped our users to find housing, we've helped our users to pay for healthcare, we've helped our users to apply for jobs. Really, that's how we think about meeting people where they are, because we see sort of the underlying consistent challenge for a lot of the families that we serve as making it through the month every month. And there is no silver bullet to make it through the month every month. That is a combination of all the different resources, public and private, that are available to a low-income family to help make ends meet. So we're super excited to have had this opportunity and would love to stay in touch and be helpful however we can in the future.
Thank you. And I think that's a very important point you just made. So look, I want to thank all of our panelists. Oh, Mr. Gray, I didn't get you.
Oh, thank you, Mr. Chairman. I just want to echo what Mr. Chen said. I think what we're discovering here today is that there's a new batch of social entrepreneurs out there that are inspired to be different from maybe some of the tech companies in the past. And it's exciting to be among them and to be able to share our stories. And so certainly optimistic about the future and willing to help in any way. And just wanted to thank you, Mr. Chairman, distinguished members of the committee and staff for allowing us to prop up our voices a little bit so that, maybe we can be part of the solution. So I just really appreciate it.
Well, I again, thank you. And I want to thank the entire panel. One thing this past year and a half has taught me is how quickly some people are to declare the way things have been always done is the only way you can get things done, the only way to proceed. I mean, we all know that isn't always true. This pandemic, as awful as it's been, has forced organizations and agencies to embrace technology in new ways, virtually overnight. Even in this chamber, even in the United States House of Representatives. And you know what? The sky didn't fall, and some things were made easier and more efficient. Even in the Rules Committee, I mean, there were some things that we had to put in place because of the pandemic, utilizing technology that we're going to keep. So we should apply these lessons as we work to end this hunger crisis. We can't be so stuck in our ways that we tolerate a process where trying to access programs to put food on the table becomes a full-time job for people. So this doesn't have to be confusing. It doesn't have to be in an infuriating mess. Technology is not a silver bullet, but it can help us end this gauntlet of red tape and program cliffs. So we should embrace it, and we should be creative, and we should be innovative. And whether it's at the public or the private sector, we ought to acknowledge that everybody has a role to play, and we ought to lift all this up. And I want to thank my colleague from Illinois, Congresswoman Schakowsky, who again is on the Energy and Commerce Committee and plays a role in overseeing all things technology related. But this is an important part of us solving this problem of hunger in this country. And so we're going to stay in touch. Thank you for taking the time.
Can I just say one thing?
Jen.
The evidence of hunger during this pandemic, I think, shocked a lot of people. The cars lined up for miles. I mean, waiting to get some food, of people who had never experienced not being able to put food on the table before, who probably even worked at pantries and, in their churches or synagogue. I mean, it was just shocking how close to hunger so many people in the United States of America are. We saw that. And so whatever tools we can bring to bear and whatever constituencies now can contribute to addressing this is so incredibly important. I can't remember, it was a huge percent of people who answered the question in the positive, have you had trouble putting food on the table in the last whatever, year? And a large number said yes to that. Shame on us. And anyway, so, whatever way I can, help and work with all of you and to continue to work with our members, I'm happy to do it.
So I'll end this session the way I usually end most sessions by saying the obvious that I think we all appreciate is hunger is essentially a political condition.
And a decision.
Right. We have the wherewithal to end it, right? The question is whether there's a political will to stitch everything together and to end it. And Jen is right. I mean, during this pandemic, we saw a whole new group of people fall into the category of being hungry because they lost their jobs. But the other kind of reality is that, yeah, while hunger went up to like 45 million people, before the pandemic was at 37 million people. And 37 million people in this country, and yet it has not been a priority. I mean, presidential debates, people never get asked about it. Gubernatorial debates, congressional debates, mayoral debates, and yet think about it. Close to 40 million people, even now. The cost, the suffering, the pain, the indignity of it all. I mean, so that's kind of what brings us all here together. And I'm like, again, it's taken me a while to understand that we need to use this committee to cut across jurisdictional boundaries and actually talk about this holistically. But that's what we're going to do. And this will end with a White House conference, whether President Biden knows it or not, but it will. And we're going to deliver. Just one thing, the last time we had a conference like this was 52 years ago. I've studied that. It was an imperfect conference. There weren't a lot of people with lived experiences whose voices were elevated. Nonetheless, it resulted in things like WIC, the expanded then food stamp program, more attention to nutrition in our schools. Unfortunately, in the 80s, the 90s, and then into the 2000s, we've begun to backslide. But the bottom line is, I mean, I think to solve this, we need the force of the White House, an all hands on deck approach, working with government and business, and nonprofits and everybody who has a role in this, to again come up with a holistic plan. And I think we will do that. So you guys are going to be our new best friends as we move forward, and we are grateful for your patience and for your participation today. And we will be in touch. So this hearing is now adjourned.